18 years of trauma surgery taught me that ritual is the only antidote to chaos. I scrub in with chlorhexidine until my knuckles blanch. The antiseptic smells like a faint bitter tea. I count to 30 on each surface of the hand. It isn't superstition. Friction dislodges. The operating theatre is a machine designed for obedience. Light booms crank into place with gas piston size. Stainless steel instruments sit orderly on a blue sterile field. Scalpels, needle drivers, debakey forceps, the fine-toothed ones for delicate tissue. Simple tools made noble by precision. The air has the background. I speak in protocol because protocol keeps people alive. When I say laparotomy, I add, for the new nurse at my shoulder, a midline incision into the abdomen. When I ask for 2 units of O negative on standby, IMI worldview is not romantic. The human torso is scaffolding and plumbing. Bone as struts, vessels as pipes, organs as pumps and sieves. Trauma is not evil. It is energy transferred too quickly for tissue to absorb. We reverse it by re-establishing. Even now, writing this, I can inventory 100 cases where technique carried the day. Ruptured spleens neatly stapled, livers stitched like fine leather, intestines reanastomosed so that what I had not considered is that a body might. The intercom crackled that night. Level 1 incoming, rollover on the expressway, hypertensive in the field, unstable. I glanced at the empty table, the light already haloed over green drapes. Prepare or 2, I said. They rolled him in, still strapped to the backboard, cervical collar white against the mottled bruise rising along his neck. The paramedics. Cadence was clipped, impersonal in the way that I translated for the circulating nurse as I walked beside the gurney. Blood pressure dangerously low in the field, unconscious on the table. His skin was sully grey, the colour of wet paper. The ventilator cuff hissed, the endotracheal tube fogged at each forced breath. I palpated the abdomen, firm, drum tight. When the belly turns into a taut drum, type and cross 4 units. 2 O-neg to start, I said. Pregnancy test irrelevant. Large bore IVs, tranexamic acid. Then, to Elena Ramirez, the pathology resident assigned to observe. You can stand at my eye, mark the midline, xiphoid to pubis, with a sterile pen. Midline laparotomy, I said for the room. A straight incision to open the abdomen and find the bleeding. The scalpel parted skin with the quiet. The first heat fogged up from the opened cavity. Blood warm enough to steam under the lights. Dark, pooled. Not the bright arterial spray of a single obvious source. Suction. The Yankawa tip chattered against the ribbed tubing as it pulled and pulled. I slipped my clamp, I said. The scrub nurse set a hemostat into my palm, that reassuring weight of machined certainty. I slid it onto a small arterial bleeder near the hilum. In a healthy vessel, another, I said, distracted. I placed a second on a small branch. Again, a faint, almost conversational tremor against my fingers. The first clamp rotated on the vessel, as if seeking release, then eased. No, slipped. Back along the slick adventitia fields wet, the scrub nurse offered, meaning the blood-made surfaces slippery. She wasn't ligation, I said. 2-0 silk. I threw a quick figure-of-8 suture across the bleeder. The needle bit. The thread drew tight. The knot seated. For a second the vessel quieted, a mouth closed by firm fingers. Then, could be fibrinolysis, Elena said softly from my shoulder. Clot breakdown. She was offering the most charitable physiology. Fibrinolysis is the body's tendency to dissolve clots. We're cold, the anesthesiologist called. pH 7.1. Calcium low. The triangle of death. Hypothermia. Acidosis. Coagulopathy. The spiral where bleeding feeds more bleeding. 2. Switch to a vascular clamp of finer teeth. Set it with deliberate pressure, then held still. Under my fingers the artery did not merely collapse. It pulled. A minute longitudinal recoil. I exposed a segment of bowel to check for mesenteric, tears. The intestine, slick and pink, should lie where you place it, obedient as coiled rope. But the loop I had set aside eased back toward the midline, not falling, edging, as if a tide under the drapes pressed from within. Spasm. I said aloud, so the room would have a word. We'll give a little papaverine. A vasodilator calms smooth muscle. In plain terms, it persuades tense pipes to relax. The scrub added the syringe to, another clamp rotated and tapped free, striking my thumb. I set it again, deeper bite. Doctor, Elena said, voice level, but pitched at me. That's fatigue and wet metal, I answered. I kept my voice as flat as the table. In my mind, I made a list. Poor grip due to blood. Vessel wall shearing. Coagulopathy making knots behave badly. Electrolyte derangement. We packed the spleen and turned to the liver. Capsular tear. Oozing. I placed a row of hemostatic pledgets. Small patches that, pressed onto bleeding surfaces, help blood clot by giving it a scaffold. They adhered. Your clamp, the scrub nurse said sharply. I looked down in time to see the vascular clamp. I'd parked on the edge of the field turn, not slide, not be jostled, pivot magnet, the anesthesiologist joked, not looking up from his numbers. His humour died in the monitor beeps. The heart rate, previously thin and quick, settled, improved when we paused. Every time I advanced, blood pressure dipped. When I stopped, continue, I said, because there was no alternative but to finish, to find the leak, to win. I set my hand, I do not frighten easily. But the quiet act of bending to retrieve a fallen instrument and seeing the next clamp shiver pack, I said. More, lap pads, we'll reassess. And in the stale, bright calm of the room designed for control, I understood that I did not sleep after that first night. I told myself I stayed in the hospital because of professional duty, because the patient remained unstable and needed continuous oversight. The truth was simpler. I needed proximity to make. We returned to the operating room 12 hours later. His abdomen had swollen further despite transfusion and careful resuscitation. The monitors charted numbers that swung between. The room was prepared again. Instruments aligned in shining rows. Suction tubing looped neatly. The lights as harsh and steady as interrogation lamps. Eleanor I reopened the midline. Immediately, dark blood welled up. Not in spurts, but in a slow, deliberate rise, as though it had been waiting for the moment. I suctioned, cleared, exposed. The sutures I had placed less. Where are your ties? The scrub nurse asked before she realized the implication. I did not answer. I placed new sutures, heavier gauge, triple knots, reinforced with pledgets. I watched them seat securely, felt the tactile click of thread tightening into itself. The second re-exploration fared no better. The spleen seemed whole one moment and split again the next. Grafts that should have been accepted were extruded from the wound margin within minutes. Afterward, in the surgeon's lounge, I spread operative reports across the table, tracing notes with the silver pen I always carried. Past cases filled with neat language. Ligation successful. Hemostasis achieved. Sutures intact. This Elena entered quietly, holding a biopsy jar. I took a small wedge of the capsule, she said. Thought pathology might clarify. She set it down. I explained because explanation was my shield. Formalin denatures proteins. It cross-links. Tissue makes it permanent, like leather stiffened. She looked at me. I had that night, while the monitors beeped their slow metronome, I dictated notes. My voice betrayed me. A catch on certain words, an unnecessary clearing of the throat. The microphone picked up tremors I did not feel. Sleep never came. I walked corridors that smelled faintly of bleach and recycled air. The hum of the air handlers grew louder as the hour stretched Elena cornered me in radiology the following morning. She had compared operative times and notes. "It's not random," she said. I corrected her automatically. "Coincidence, mechanical, slippage. Blood acts like oil, it." The next procedure, our third return to the same wound, proved the pattern undeniable. Every pad I placed was expelled. Every clamp quivered, then eased loose. And when I paused, when I allowed the wound to I felt a thought form, crude and treacherous. Perhaps my scalpel was not healing but assault. Perhaps every entry was interpreted as. Yet even with those verbal shields, the image lingered. A drowning man clutching for air, not by logic but, after the third operation, I found Elena in the pathology lab, staring at another. The phrasing unsettled me more than the phenomenon itself. It doesn't. Not the patient. When I returned to the OR, I washed my hands with the same ritual precision as always. Yet the water seemed colder, and the every step of protocol felt suddenly fragile, like paper shields. And for the first time in 18 years, as I prepared to operate, Elena found me in the lab at dawn, a thin shadow among racks of slides and jars. Her gloved hand trembled only slightly as she sat. I bent to the eyepiece. The field swam into focus, stained tissue from our patient's abdominal wall. At this magnification, cells should appear static, fixed forever in place by chemical stains. Impossible, I whispered, though the word came out clinical, flat. Cells can't migrate once. Then explain it, Elena said. Her tone wasn't combative, but neither was I. Straightened, removed my gloves with deliberate slowness. Under normal physiology, cells crawl to close wounds, fibroblasts lay collagen, epithelial cells slide to cover. I looked again. The migration was subtle, but directional. Away from the cut edge, away from the patient's vitals told a parallel story. When we touched him, even to adjust tubing or reposition his limbs, his eye gathered the residents at bedside. Trauma physiology, I lectured, my voice sharp to mask unease. When the body senses invasion, it responds. Blood vessels clamp down, the heart struggles, the immune Elena tilted her head. It's like, the word once lodged in me like shrapnel. I deflected. Correlation doesn't equal intention. Biology. That night I stayed in the OR after everyone left, reviewing supplies, arranging clamps as though their symmetry could restore order. The room smelled faintly of iodine and singed cautery. I leaned on the table where we had operated, the green drape folded into, then came the sound. A faint tick, tick, tick from the instrument tray. I turned, expecting to see condensation dripping. Instead, sutures, unused, still threaded into curved needles, where I approached, my rational mind building explanations. Temperature shifts, tension in the thread, drying that altered tension. But as Ty did not flinch, though my mouth tasted metallic, the way it does after sudden blood loss. I simply dictated into my recorder. Observation. Multiple suture hours later, the real proof came. I stood at the patient's bedside for a routine check. His skin glistened with antiseptic film, the lines of tubing running like extra. Then I slid the diaphragm lower to the abdomen. A noise rose beneath the usual intestinal gurgles, a slow, deliberate. I reached for the scalpel on the tray to adjust a dressing. At the instant the steel edge neared, his entire torso spasmed. Not a seizure, not random Elena, who had come in silently behind. No, I admitted. My voice cracked for the first. We stood in silence, the monitors tracing their steady lines. The scalpel lay where it had fallen, gleaming under fluorescent light. For 18 years I had believed the body was scaffolding and plumbing, a passive structure waiting for repair. But in that, the body knew, and worse, if the next operation was already scheduled. I dreaded it with the cold certainty of the question that haunted me was not, It was weather the patient's body. The crash call came at 02:11, when fluorescent light has the temperature of bone and every corridor feels like the inside of a chest tube. "He's dropping," anesthesia said over the intercom, voice too steady for the numbers he read. "Pressure in free fall, oxygen saturation." "Emergency re-exploration," I said, because naming a thing builds a scaffold around panic. "Massive." "Transfusion protocol on. Warmers maxed. Calcium ready. Push phenylephrine." I set the recorder. The team filled the perimeter. Scrub nurse, circulating nurse, a second attending called from home, 2 residents, Elena at my left shoulder. The anesthesiologist adjusted vents with the air of a pianist who knows the instrument. "Is out of tune midline incision, extending prior," I said for the record. "Indication, hemodynamic collapse with presumed intra-abdominal source." In the scalpel kissed the old scar, skin parted with the softness of wet cloth. The peritoneum, that thin, glistening inner curtain, released a breath of heat. Blood lifted to meet us. Thick, dark, not under at first. The sequence felt familiar. Evacuate blood. Pack quadrants. Survey for the source like turning off valves in a flooded house to hear which pipe still hisses. I placed my right hand along the left upper quadrant. Spleen bed. Packed. Moved to. They adhered for a breath. Then, with a motion so small it could have been imagined, each pad curled at one corner and lifted, not buoyed. "More suction," I said. "We're losing visualization." The resident retracted the abdominal wall. "The retractor?" The second attending leaned in. "Do you want a Pringle maneuver?" he asked, occluding the hepatic inflow to see if liver bleeding stops. In lay terms, a temporary pinch on the liver's faucet. "Yes," the monitor should have responded. When you do this correctly, liver bleeding diminishes like turning down a tap. Instead, the oozing intensified, as if the liver, insulted, perfused itself harder. "Another clamp," I said. The scrub placed it in my palm with the reverence you give a solution. I set it carefully on a small arterial branch, metal met vessel. The beak of the clamp should have been stronger than meat. It should have made the vessel obey, the way pliers override a stripped screw. Under my fingers, the artery shortened. A tiny Elena's breath fogged her shield. "Doctor," she said, pitched low, so it would belong to me alone. "Look at the bowel." I followed her gloved finger. The loop I had lifted for inspection did not simply fall back by gravity. It withdrew. The second attending reached in, stubborn and skilled, to place a stitch across a liver tear. His needle entered and exited in a clean arc. He tied the knot with a captain's firmness. It seated. Then, "This is coagulopathy," he said reflexively, invoking the triad we all fear: cold, acid, thin blood. "The knots won't hold because the tissue's friable. Warmers are maxed," anesthesia called. "Blood gases improving with ventilation." I heard the numbers, heard that our supportive measures were doing what they should. And yet every time metal I began to narrate the impossibilities, because explanation is the last mask before fear. "For the record," I said evenly, "clamps are failing despite correct placement. In a sealed system, tooling failure occurs either." The resident at my right frowned at the raw edge of the spleen bed. "Could the capsule be contracting?" he asked. "Smooth muscle spasm?" In lay terms, "The outer spreader," I said, and received a retractor designed to open a pelvis, wide. I set it gently, cranking a notch, then another. Metal creaked. At the third notch, the retractor's arms, "Doctor." Eleanor's voice broke into a register I had not heard before, alarm laced with disbelief. "The liver." She didn't finish. There are moments the mind refuses grammar. We all saw it. The scrub nurse made a small sound I have only heard once, in a delivery room. "We're not operating on him," I heard myself say. the words sounding distant. Silence pressed around that sentence. Even the ventilator seemed to measure its size. The second attending reached again, as if muscle memory could outstare novelty. The clamp he advanced rotated on its hinge and turned toward his wrist. It shouldn't. The monitors pitched higher. Vitach! Anesthesia barked, then corrected himself as the rhythm resolved without medication. I can explain that. Sometimes the heart stumbles and catches itself. But what I cannot explain is the way the QRS stop, I said, and raised both hands. The team froze. The suction sighed itself quiet. For a long breath, the room held us all between choices. The pressure crept from 60 medicine does not have a verb for that. Healing by absence. We fill space with action because action is how we are paid, trained, judged. The impulse to intervene is the marrow of our doctor. Elena's voice again, this time so soft it wasn't meant for the room. What if it's not about him, Matt? It was not a thought. It was an alignment, like vertebrae snapping back into place. I saw the prior night's recast. The self-undoing knots. Resume, I said, because the pressure slipped again. Doing nothing was not a solution. It was a stall. We have to drain the hemoperitoneum. I forced my hand into the red heat epinephrine, anesthesia called. Pressure's gone. The lines on the monitor disgorged into noise. We were in the endgame now, the phase where algorithms replace thought because there is. I lifted my hands. No compressions, I said, and the room sucked in breath like one organism. His abdomen is open. We'll force blood out. Internal. Massage only. I slipped my hand beneath the sternum and found the heart. In textbooks, it bucked under my palm. Not flailed. Bucked. A coordinated wrench away. I do not anthropomorphize. I do not give organs verbs that belong to animals. But this was the movement of an animal. I tried time, anesthesia said. Voice. Steady because counting bys continue, I said, though I knew the arithmetic of brain death better than any of them. At 5 minutes without perfusion, neurons begin to die. At 10, the second attending attempted a vascular clamp deeper along the aorta to shunt blood to the brain. The aorta is obedient under a clamp. It is the Elena's gloved hand tightened on the retractor. It sees us, she said. I wanted to correct her pronoun, to sand the sentence back to acceptable terms. Time. Anesthesia. Stop, I said, because there is a point where you must plant a flag in the sand of your own. Ethics. I withdrew my hand and looked at the heart. Call it. The time of death, 02:29, I said. My voice did not shake. The words fell into the recorder. We stood back. Instruments stilled. The ventilator sighed one last automatic sigh. And then the room. The abdominal wall tightened. Not rigor, which takes hours as proteins lock into place. Not post-mortem spasm, which is brief and meaningless. This was a controlled closure, a drawing in of muscle and fascia that narrowed the wound like a purse string pulled by the monitor, which should have been a flat line now, displayed artifacts, tiny deflections that in other contexts we would call noise. Electrical interference, wire jostle, a nurse leaning over the. I spoke for the record because habit is the last country to fall. Observation, post-mortem coordinated muscular activity persisting beyond cessation. The second attending made the sign of the cross. I do not judge men who pray. We all have our shields. Mine is language. Elena did not. The abdomen continued its slow, inward draw, like a creature curling around a wound. The sutures at the edge, unused, coiled like little question marks, unwound on their own until. We waited until the motion settled, which took longer than any of us were prepared to admit later. The room cooled by a degree 2 dictated one more line because the absence of a line would have been a lie. Conclusion. Conventional interventions failed. Phenomena observed are incompatible with known physiology. Eno 1 answered. There is nothing to say to a man who has. I stripped my gloves. My hands were white and puckered, the creases deeper, as if the skin had been aged by proximity to whatever had moved. Document everything, I told the circulating nurse, and my voice sounded like a stranger's. Hoarse around, the Elena followed me to the sink. We washed in silence, chlorhexidine rising in its bitter bloom. The truth, I said, and heard the impossibility in the sentence. There are truths hospitals do not accept. Not behind us. The body settled into stillness that did not feel like peace. The belly's last small drawer left the incision margins. I dried my hands, fingers to elbows, new towel for each, and reached for my silver pen. Its weight steadied me. The report would require language. The doors sighed open, letting in a blade of colder corridor air. I stepped toward it, aware of the team's quiet behind me, aware of I went to write the case. The first thing I learned in medicine was how to document, not how to suture, not how to clamp, but how to write a note that another clinician could read at 3 a.m. and know exactly what had been done. I sat at the workstation outside the OR, scrub still damp at the cuffs, the smell of iodine, clinging like regret. The cursor blinked against a blank operative report. I began as I always had. Exploratory laparotomy performed for hemodynamic collapse. The words were obedient, predictable. 2 tried substitutions. Persistent bleeding, uncontrolled ooze, failure of standard interventions. Each phrase was accurate in its surface, yet each buried the truth. The body. The administrator's protocol is merciless. For every unexplained death, a morbidity and mortality review. I imagined the conference room filled with colleagues, their pens tapping as I recited. Clamp failure, I would say. Tissue non-compliant. They would nod, offer suggestions, cite obscure coagulation disorders, recommend new instruments. No one would, I wrote, death pronounced at 02:29. Then Elena found me hours later in the residence lounge, the silver pen clenched in my fist like a scalpel I could not sheathe. Her face, I shook my head. Reflexive denial. Extreme physiology, catastrophic trauma, coagulopathy, the old litany, still warm from use. But no, she whispered, the body didn't want you. The admission burned in my throat. 18 years of training demanded I correct her. To agree would be to betray every protocol, every algorithm that had guided my hands. But the image of she searched my face. Then, straightened. If you, I should have ordered her to stop, reminded her of hierarchy, of professional boundaries. Instead, I only said, be careful, no one forgives a resident who. The hospital moved quickly to erase the anomaly. The chart was, sealed with a summary I did not write. Unprecedented intraoperative hemorrhage, refractory to standard interventions. A phrase designed to anesthetize inquiry. At the review, colleagues I signed the minutes with my silver pen, each stroke of my name a betrayal. The case was buried in the for me. I walked into the chief's office the next morning with a resignation letter folded in my pocket, 18 years distilled to 3 sentences. Effective immediately. Gratitude for the years, regret for the necessity. He looked up, surprised, then relieved, as I left the hospital with my hands empty. No scalpel, no gloves, no charts. Only the memory. It has been weeks, and I still hear it in the quiet hours. The faint tick of sutures unraveling, the tremor of clamps slipping from flesh. Sometimes, as I have not picked, and I fear the next.